for this week, we're going to talk about the clinical laboratory. What are the different processes that you must undergo when you're going to establish a clinical lab? So of course, if you are going to establish a clinical lab, the first thing you need to consider will be the management system or management process in your laboratory. Now under that is the operation management. First is what we call the quality assurance. So when you say quality assurance, it means that you're making sure that all of the process, all of the procedure in your laboratory is at par with the Philippine standard, and that you are actually going to produce accurate and precise results. Now, for you to make sure that you're going to produce accurate and precise results, of course, your lab must have established policy and procedure. So sabi ko nga sa inyo last time, when you say policy, these are what you call the printed guidelines that you're actually going to follow in your laboratory. And then, under those guidelines, are different procedures that you are going to follow to make sure that the laboratory is functioning up to the set standards. So, saan nagagaling yung standards? So, sabi ko nga last time, nagagaling siya sa mga different agencies. Okay? So, it depends on the type of standard you're going to refer to. So, usually, pagdating sa laboratory, yung mga standard that we are actually following came from the CLSI, di ba? Sinabi ko sa inyo last time, right? Or the Clinical Laboratory Standards Institute. Another thing is what you call strategic planning. So, tandaan nyo, kahit laboratory yan, it is still a business. So, you must be able to have a layout or printed plan on how you're going to strategize for the laboratory to still function. Kasi nga business yan. So, when you say strat planning, you're going to consider your competitors here. So, ano ba yung magiging advantage mo from your competitors para ang puntahan ng mga tao is your laboratory, not the other laboratories available in the area. Okay? So, kapag strat plan, this is all about planning on how to make the business well. So, you're going to plan different strategies pagdating sa marketing, okay? Pagdating sa financial management, and of course, sa services. Now, benchmarking, this is a procedure or this is a practice being done where you're going to actually go to another laboratory, then observe what is being practiced in another laboratory so that you can adapt the best practices. So, ang ginagawa dito is, yun nga, you go to another lab and then you take note of the different equipment, ano ba yung kanilang ginagamit na equipment, yung kanilang quality control program, how do they make sure that the results are accurate and precise, and then the best practices that is being done in that laboratory. So you're going to observe what are the different best practices that are being done on the laboratory that you're actually observing. And then pagbalik mo sa laboratory mo, it is up to you if you want to adapt those best practices or not. That is what you call benchmarking. So, ginagawa talaga to sa industry kasi nga naman, hindi naman lahat ay specialized, diba? So, usually, kapag ikaw nagsisimula kang laboratory, small lab ka lang, nag-benchmark ka sa mga lab na malalaki, yung mga established na lab na sikat na talaga. Okay? In order for you to learn din kung paano sila nakarating doon. Kasi their best practices are actually the key on how that laboratory is very successful. Now, another thing is your productivity assessment. So, kapag productivity assessment, ano ba yung chance na yung kikita ang laboratory na ito? So, this involves all about planning on how you're going to make sure that the finances are actually stable. Okay? And then besides that, when you say productivity, you're also going to talk about the number of output coming from the laboratory. So, ilang test ba ang kayang gawin ng laboratory mo sa isang araw? Ilang results ba ang kaya nyong ilabas sa isang araw? Okay? Another thing is the legislation and also regulations, of course. Kapag legislation and regulation, this is all about the law. Philippine laws and standards that you have to follow when you are establishing the laboratory. Of course, you have medical legal concerns if you are that type of laboratory handling cases under the pathology department. Pwede rin, mga medical legal concerns. However, sa specialized lab lang ito kasi hindi naman yung mga freestanding lab natin that you see on the side of the street, diba? Yung mga nasa karsada na laboratory lang, usually yung wala naman sila mga medical legal concern kasi yung services being offered to that laboratory are limited. But for the laboratory based in the hospital, yes, they also must have a procedure or policy regarding medical legal concerns. Of course, continuing education para yan sa mga staff, because as we all know, ang staff na walang proper training is at risk of actually causing problems in your laboratory. So, hindi lang porket tapos ka na ng medtech, okay na yan. So, yung mga staff na yan being employed in the laboratory must be updated pagdating sa mga new technologies and new techniques pagdating sa practice in the laboratory. And of course, staff meeting. Staff meeting is very important because you're able to communicate well with your staff regarding the different policies, different procedures, and different issues inside the laboratory. Okay, so that is actually being conducted regularly. Now, what are the different basic management responsibilities? Now, first is the human resource management. So, when you say human resource management, it involves finding those different personnel that will actually work in your laboratory. And then, hindi lang basta-basta kasi yan kung sino man ang tao na hatakin mo dyan, o tara na, magtrabaho ka na dito. Hindi. Of course, dapat meron siyang tinatawag na mga credentials, diba? Or what you call competency assessment. So, ano ba yung mga factors to consider under human resource management? So, first, if you're establishing a laboratory, dapat meron kang specific job description sa mga staff. Okay? So, ano ba yung mga job description nila? Ang medtech ba? Part ba ng trabaho ng isang medtech ang paghuhugas or pagtapon ng mga basura? Okay? So, dapat klaro yan. Actually, this happens sa mga small laboratory, lalo na yung mga bagon that are actually nagsisimula pa lang, di ba? Syempre, kapag small lang yung lab, nagsisimula pa lang, yung medtech staff dyan, hindi lang testing ang ginagawa niya, marami din siya iba pang ginagawa. So, pwede rin siyang, yung medtech staff, besides testing, pwede rin siyang mag-function as cashier, di ba? Or secretary, right? Or even the lab tech. Minsan, medtech siya, lab tech pa rin siya. So, dapat klaro sa job description. Kasi nga naman, hindi naman lahat ng laboratory ay nagsisimula ng malaki. Okay? So, ganun. Basta importante meron kang job description na binibigay sa mga staff mo. Ano ba yung kanilang trabaho? Tsaka ano ba yung extent ng kanilang trabaho? Hanggang ano ba yung mga dapat nilang gawin? Okay? So, another thing is the recruitment and staffing. So, what are the process on how you're going to recruit your staff? And then, of course, orientation sa staff. That is very important. On the first day of work, yung staff na yan, yung mga hospital staff mo, they must be properly oriented. Ano ba yung mga ginagawa during orientation? Of course, you're going to teach what are the different policies in the hospital or in the lab. So, this is all about training sa mga staff or giving them orientation regarding the different policies in that laboratory. Ano ba yung mga policy nyo? Ano ba yung mga standard operating procedures? Okay? And what are the different things that they need to know that are related to the function and process inside the laboratory? Okay? So, yun lang naman na kailangan sa mga orientation programs na yan. And of course, this is also the proper venue for the new employees to actually ask their questions regarding their concerns sa kanilang workplace. So, kung meron sa mga question or clarification regarding sa mga benefits nila, okay, sa kanilang salary, or even sa kanilang job description, then pwede na nang tanungin during orientation. And then, yun na nangyayari during orientation. So, another thing is competency assessment. Okay, so when you say competency assessment, you're actually screening the applicant. You're going to check yung kanyang credentials. Ito ba ay pasok sa ating mga qualifications being set by the company. Kunyari, kung medtech, syempre, graduate ba yan ng medical technology? Pasado ba yan ng board exam? Etc. Okay? That is what you call the competency assessment. Now, personal records. Kapag personal records, you're actually keeping the records of your staff. These are confidential records. So, ito yung kanilang mga background information, their curriculum vitae, their credentials from the school, their credentials from previous employers, etc. Okay? So, lahat ng mga confidential records that are actually related to the personnel or to the staff. Of course, another confidential is called performance evaluation. So, tandaan nyo, when you say performance evaluation, it means that you are evaluating the staff if the staff is it still working properly? Okay, kung tama pa yung kanyang mga process na ginagawa sa laboratory. And then, the results of the performance evaluation should always be confidential. So, hindi mo siya pwedeng i-share sa ibang katrabaho niya. So, dapat ang nakakaalam lang nun is the supervisor, the concerned staff, okay, na na-evaluate, and then the records are being kept in the Human Resource Center or the HRD. And of course, meron ka dapat procedure pagdating sa discipline and dismissal process. So, pwede bang basta nalang magtanggal ng tao agad-agad? Okay, hindi, di ba? Kasi nga, you're violating the labor laws of the Philippines. Okay, so there must be a policy regarding employee discipline and employee dismissal. So, kapag employee discipline, ito yung mga pwedeng masuspend yung employee. Kunyari, lagi siyang late. So, pwede siya masuspend. So, okay lang naman magbigay ng mga sanctions sa employee as long as yung mga sanctions na yon is nasa policy na institution, and all of those sanctions were discussed thoroughly to the employee during orientation. So, part din yan ng orientation process that you have to discuss what are the different disciplinary actions and grounds for dismissal of an employee, kasi karapatan nila yan. So, next, of course, is financial management. This is very important because you are actually establishing a business, diba? So, dapat meron kang budget, you must have a billing, cost analysis, and fee schedule maintenance. So, when you say test cost analysis, you're actually going to consider what are the different tests that you're going to perform in the lab and how much are you going to invest in the laboratory. So, sa isang test, magkano ba ang investment ko dito? For example, sa glucose testing, di ba? So, you are investing in a machine. Bumili ka ng makina. Okay? And then, yung makina na yan, nakasaksak yan, so gumagamit ka ng kuryente. Tapos, yung glucose testing na yan, hindi lang naman makina ang ginamit mo, meron ka rin staff, di ba? Meron ka medic na kailangan magsweldo. And then, meron ka pang mga reagents and chemicals na ginamit for the glucose testing. So, all of those costs, lahat ng gastos mo, you must be able to consider that, and then you must be able to put that in your price. Anyway, pagdating naman kasi sa pricing, meron naman talagang standard pricing being set by the DOH and also from the DTI, di ba? May mga standard pricing yan. However, definitely, kapag ang ginamit mo materials is much more expensive. For example, ang brand ng machine nyo is Roche. Diba? Kapag Roche, mahal talaga yan eh. Kasi it is a international brand na kilalang kilala. So, alam naman natin na kapag Roche ang machine, talagang reliable siya. Okay? So, para siyang mga branded brands. So, kapag ganun, ang ginamit mo machine, mga branded, mga international name, definitely mahal yan. So, mas mataas ang investment mo. So, definitely, yung prices, mas mataas. Mas mataas ang singil mo sa blood glucose. Okay? So, those are the example of things you must consider pagdating sa test cost analysis. Another thing is the fee schedule maintenance. So, when you say schedule maintenance, ibig sabihin noon is that yung mga machine mo, all of those equipment or machines in your laboratory must undergo, of course, dapat meron siyang regular preventive maintenance. When you say preventive maintenance, an engineer or specialist coming from the company that supplied you the machine. So, saan mo ba binili yung machine na yan? Okay? Kunyari, your machine is Roche, di ba? So, kapag Roche, there's a specialist coming from Roche that will go to your laboratory regularly to check on the machine para tignan kung well-functioning po ba yung machine na yon. And of course, may bayad yon. Nagbabayad ka sa company that are actually providing you that services. Okay? That is what you call the fee schedule maintenance. So, kasama rin siya sa test cost analysis mo. So, part yun ng financial management pagdating sa lab. Hindi lang siya budget, hindi lang billing. Tandaan nyo, lagi kang meron dyan na maintenance fee. Kasi importante yon for you to make sure that all of the machines are functioning well. Ganun talaga. Regularly, merong engineer na nagpupunta coming from the company na pinagbilan ng machine na yon. Pupunta siya from time to time to check on the machine. And then kada punta niya, merong bayad yun. And you have to pay for that. Now, another thing is the marketing management. Of course, your company will not survive without marketing, di ba? So, nagtayo ka nga ng laboratory, how are you going to make sure na may mga taong pupunta sa laboratory mo? So, of course, part of the marketing management is customer service. So, for the customer service, minsan namihingi tayo ng feedback from our customers, di ba? Kung after they go to your laboratory, pwede kang magbigay ng short survey form lang, and then mag-check sila doon kung satisfied ba sila sa services na nakuha nila. Kasi once satisfied sila, your laboratory will actually become popular. Kasi syempre, pag uwi nila sa bahay, pag uwi nila sa mga kaibigan nila, pwede nilang sabihin na, nagpunta ako sa laboratory na ito, maganda ang services ng lab na ito. So, you can actually be recommended by word of mouth. So, that is actually part of the marketing management. Yun ang pinaka-basic sa marketing eh. Dapat satisfied yung customer. Another thing is outreach marketing, where you're going to go out of the area in your laboratory and actually perform flyering, di ba? So, part yan ng advertising eh. Yung mga lumalabas, tas nag-aabot mga flyers. That's what you call the outreach marketing. Website development, of course, and client education. So, what are the different issues to consider when establishing a laboratory? First is the environmental assessment. So, what are the customer needs, diba? Of course, if you're going to establish a laboratory sa isang lugar na 6 na ang laboratory nakatayo, ikaw yung pampito, do you think kikita ka pa? Do you think you are important? Diba? Definitely, kung ganun na situation, well, you must offer a different service. Kunyari, yung 6 na laboratory na yun, puro lang sila routine lab. Then, nagagawin magtatayo ka ng specialized lab. Definitely, pupuntahan ka talaga, 'di ba? So, ano ba yung kailangan sa area mo? Ano ba yung kailangan? Ano ba yung in demand sa area nyo in order for you to establish that business first? Okay? Kapag nakita mo na hindi ka naman kailangan sa lugar na yun kasi sobrang dami na, definitely find another place. Okay? So, what are the customer needs? Who is the competition? Yan. Kung marami nga nakatayong laboratory doon, medyo malabo na yung chance na maging successful yung lab mo. And do not forget the 4 P's of marketing. You must have the product, the price, the place, and of course, promotion. Now, for the environmental assessment, so you must have the right testing menu. So, what are the different services that you're going to offer? Tulad nga nasabi ko kanina, kung 7 ang laboratory dyan, yung 6, puro sila routine, ikaw, special lab. 'Di ba? So, dapat iibahin mo kung ano yung mga test na you're going to offer if you want that laboratory to survive in that type of environment. Okay? Yan ay kapag maraming competition. So, ano ba yung right testing menu? What are the different specific services that are special that you can offer in order for the people to come to your lab? And of course, the different equipments, facilities, and personnel, adequate financial resources, and test cost analysis. All of that is part of the environmental assessment. So, when you say equipment, you're pertaining to all of those things or materials that you need in your laboratory, facilities, the actual laboratory itself, the personnel, which is your staff, the financial resources, and of course, your test cost analysis. Now, for the customer segments or specific targets, of course, you must consider the healthcare providers. Kasi nga naman, these healthcare providers will be the source of your staff. So, gaano ba karami yung or kalaki yung chance na sa isang lugar na yan, meron mga healthcare provider living nearby. Kasi usually, kapag may mga ganon, then they are the one who will apply to your laboratory. And of course, hospital lab and physician office laboratories, kasi dito ka kumukuha ng mga referral. 'Di ba? Because sometimes may mga doktor na kahit alam nila na may lab naman sa ospital, they will refer the patients to your laboratory outside the hospital. Okay? So, dapat makakuha ka rin ng mga referral. And of course, insurance companies. Yung insurance companies na yan, you're going to affiliate with them in order for them to, for those people having those insurance come to your laboratory. So, ang magbabayad ng mga laboratory tests is the insurance company. And dapat affiliated ka rin sa insurance company na yon para yung mga clients nila ay pupunta sa laboratory mo para puntahan ka. College, universities, and other school. Because as we all know, kapag may mga school, maraming tao. So, yung visibility ng lab mo ay mataas. Another thing is the nursing home, home health agencies and clinics kasi ito yung mga magiging source of patient mo. Researcher, clinical trials, pharmaceutical companies. So, ito yung mga possible na mag-refer ng mga testing sa laboratory mo. Unique socio-economic status and ethnics. Of course, kapag yung area is affluent, then definitely possible na marami kang maging kliyente. Population shift, rural, urban, or suburban. Now, under the process and marketing, of course, you must develop a sales marketing plan. So, example of that is having brochures, specimen collection manuals, other cost-related materials, and of course, your website. And of course, infrastructure must be adequate lagi. Kasi nga naman, yung physical facility ng isang laboratory is one of the things that you must consider. Dapat pleasing siya sa eyes ng mga tao para puntahan siya. And support and maintain existing client services and place advertisement. Itong support and maintain existing client services, this is very important kasi nga naman, your services will be talked about by your client. So, kapag yung client mo nagkaroon siya ng bad experience dyan sa laboratory, then definitely kukwento niya yan sa kanya mga kakilala. So, yung name ng lab mo, nakakaroon na ng pangit na record. Okay? So, hindi dapat ganun. Kasi nga, one of the way para mag-market ka is through word of mouth.